can feel. Who stole your heart? Who took it away? Knowing that without it you can't live. Who took away the part?
Hello.
So essential to the whole.
Another beautiful Saturday on the Y.W.W.B initiative. Welcome, 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 welcome. Thank you so much for being a part of this program today. My name is Rosemary Henry Eze, and I am so happy to have you live on today's show. It's another beautiful Saturday, and we do not take every Saturday for granted. And today is another beautiful Saturday, and we have with us, we'll be having with us rather, a professional, a medical doctor, who will be talking to us extensively on post-traumatic disorder in women, post-traumatic stress disorder in women. How are you? How has your week been? And like our norm is, once you come in, please tell us where you are joining us from. Like I said, my name is Rosemary Henry Eze, and I coordinate the affairs of the Young Women and Wives with Burdens and Blessing. And the Young Women and Wives with Burdens and Blessing is an initiative that has been, created that centers around empowering women through education. Those are one of their objectives, promoting health and well-being. We also fostering healthy relationships and dynamic family. And we also talk about providing parenting support and guidance, and then building a supportive community, and then facilitating open discussions for growth, like what we are having today. Discussions for growth are very key in our mind, and also promoting personal growth and wholeness. These key objectives is what the Y.W.W.B initiative is centered around. And it might actually sound like a mouthful. I've had people say, "Oh, Y.W.W.B, it's so much, so much. It's exactly a mouthful." But the essence of it is that we want to ensure that we reach, we reach out to women to actually help them in their journey to wholeness. So our objectives, like I said, is that our objective is centered around, number one, empowering women through education. Education is very important, and someone will say, if you say education is expensive, try ignorance. And a lot of women who are not empowered through education have actually come up to say, "Oh, how I wish I have had the opportunity to get education." We also promote health and well-being. The health and well-being of the woman is of paramount importance to us. And like we said, health and well-being, that is why we come on this show, on this platform rather, and we talk about topics that are very, very important to the wholeness of the woman. The wholeness of the woman for us is a journey. It's a journey. It's a journey. It's a journey. And this evening, like I said earlier, we'll be talking on the topic post-traumatic stress disorder in women. And fortunately, I have with me already in house our guest, the person of Taiye Abu. And I want to say a big welcome. Thank you for joining us. Olabisi Rachel, straight from Nigeria. Thank you, Ma. And I also have Rila Kide. Thank you for joining us this evening. For everyone who is joining us live, I just want to say thank you for being a part of this program. I sat down last night, and I said to myself, we are gradually, this is April, and like yesterday, as they would say, this program took off. We had on the 15th of June 2004, we had the first we had the launch, the inaugural service of this discussion platform. And wow, 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 indeed. And indeed, it has been really a worthwhile journey. It has been a worthwhile journey. it has been a worthwhile journey. And I look back, I was looking at the first, the launch, the first discussion we had, the first topic we had. And I said to myself, is that me? Is that me? Is that me? Thank you so much. I just want to take some to say thank you to everyone who has graced this platform as speakers. And there's one thing that is very unique about this platform, and that is the fact that this platform, our speakers, the mandate is that our speakers has to be women. Though we have sometimes have men coming, but those topics are topics that we actually desire a man's perspective. But all our speakers have always been women. I want to say a big thank you. I can't exhaust mentioning them. We've had over more than we've had we have over 30 speakers come on this platform within the course of 1 year. And I sat down and I said to myself, wow, when this was to start out, I never envisaged the ease and the grace. And as we say in Christendom, I'm a Christian and a person of faith and also a Christian, like I said, it will say that God will not commit what he will not fund into your hand. Thank you so much. Welcome, Doctor. Good to see you. You, man. Good to have you.
I can't see you though. I can't see you though.
That's Facebook Paro. That's
Oh,
Facebook Paro. Don't worry.
okay.
But I can see, you can't see me. That is Facebook latest style. That's why they are deleting
Okay.
videos.
Oh,
Yes, ma'am. But please, you have
okay.
the floor. Yeah, so you have
Okay.
20 minutes of discussion. I will go right through straight to our Q and A. Thank you, ma'am.
All right. Thank you very much. Thank you to the organizers of this the program. Thank you for the opportunity to be in this wonderful platform. Like she said, my name is Dr. Taiye Abu. I am a practicing psychiatrist here in England, and we'll be talking today on post-traumatic stress disorder in women. When I saw the topic, it really caught my attention because this is something I deal with a lot all the time. And I was really happy that, I'm given the opportunity to talk to us women on this topic. So today, we'll be talking about the signs, the symptoms, and the recovery strategy of post-traumatic stress disorder. It's a wide topic, but I'll try and do my best to utilize the time that I've been given. As a way of introduction, what is trauma? Trauma is a deep emotional response to a distressing or disturbing event that, overwhelms a person's ability to cope, and it can affect the mind, it can affect the body, it can affect the emotions. Another person define trauma as an emotional or psychological response to a deeply distressing or disturbing event, often leaving lasting effects on people, on their mental well-being, on their physical well-being. So when we look at trauma, it is something that the impact is large, and if not carefully handled, can actually affect people. And when you talk about post-traumatic stress disorder, it's actually a mental health condition, and this happens when a person has been exposed to a very traumatic event. So I'll try not to go to medical because I know not everybody here is medical. So we have what we post-traumatic stress disorder, and then you have complex post-traumatic stress disorder. And that happens when people have been exposed to repeated trauma. So for a person that has been exposed to one traumatic event, we can say the person has PTSD. But for a person that has been exposed to multiple traumatic events, then the person can be classified to, have experienced complex PTSD, that's post-traumatic stress disorder. And, there are all different forms of trauma. When you're talking about trauma, it can take different forms. You have women that have been exposed to physical trauma, people that when are in abusive relationships where their partners, physically abuse them. And, some traumatic experience can even be from, car crash, things that affect their physical body, violence, maybe falls, and it can actually affect their emotion, them psychologically. That's one form of trauma, physical trauma. Another form of trauma is emotional or psychological trauma. And the truth is that a lot of women are exposed to this kind of trauma. And you say someone is emotionally being abused when the person is exposed to events or traumatic events that, upsets them deeply, that upsets their emotion. For example, you have different types of emotional trauma. It can be, bullying. Some women are being bullied by their partners. They are being bullied by their bosses at work, just because they are women. Betrayers, their partners cheating on them, their partners gaslighting them, talking to them, hurting their emotions. You have situations of, women that have lost themselves because of the things that their partners tell them. Emotional abuse, I tell you, it can be terrible. You have sexual trauma too. We are looking at the forms of trauma. You have women that have been exposed to, sexual assault. Some have been raped, some have been, exploited, some have been harassed sexually, some have been assaulted sexually. Because when you talk about sexual trauma, people just look at it as, oh, rape. It's not just rape. There are people that, they have been in position where part of their body has been touched without their consent. That is sexual abuse. That is sexual abuse. So this kind of thing, people have been exposed to it, and it can actually, damage them. Then another form of trauma is developmental trauma. And you see this kind of trauma in people that have been exposed to childhood trauma. I tell you, the impact of childhood trauma in a person is terrible. I've seen a lot of individuals that were exposed to childhood, traumatic events that turned their lives forever. Those that experience maybe neglect, their parents neglected them, their parents abandoned them, their parents, some abuse as children, they were abused physically, they were abused sexually. And then because they were children, they were not able to speak about these things. And then even I had back home when I was in Nigeria, practicing, there was a parent, a mom, she brought her child. I think that child would be about 5, 6 years. And she was like, oh, doctor, I would like you to see the child. And I'm like, okay, what's the issue? And she was like, her husband is sleeping with the child. And when she told me, I was like, okay. She said, just give the child a medication that will take care of any infection and everything. And I was like, okay, is that all? There are services that we can refer you to help you. She said, no, don't worry, that she has reported it to the family, and then the family have told her not to expose it, that, if they expose it, it will be tarnishing the family, and, them to hide it. And then if the man drives her out of the house, how is she going to take care of the children? So imagine a child at that age being exposed to such kind of, traumatic event. I can tell you that child will not remain the same. So you have developmental trauma, childhood trauma, then complex trauma, like I said, people that have been exposed to, repeated trauma. And then, other forms of trauma that, some forms of trauma that women, that are peculiar to trauma, to women in particular, is verbal abuse. Some women are in situations, they're in relationships where their partners verbally abuse them. And this, eventually traumatizes them, where you keep hearing from your partner how useless you are, how incapable you are, how terrible you are as a mother, as a wife. People just say, but it's just saying it. There's nothing, it's just words. Words are not doing anything. I tell you, words, the impact of words is something. When you keep hearing negative words about yourself every time, at a point, you begin to accept those words. And those people become traumatized because they keep hearing negative words. And at a point, they begin to accept that this is who they are. And those people eventually become broken. Now, we're going to be looking at, remember, we're talking about post-traumatic stress disorder. We're going to be looking at symptoms that people will exhibit when they have post-traumatic stress disorder. Now, for a person that has been exposed to different forms of trauma that we've talked about, some of them start having, they re-experience the trauma. What do I mean by this? You see them, they can just sit down and they are having flashbacks. They are having flashbacks. They are reliving the moment. So, for example, a woman that has been exposed to physical abuse from somebody or sexual abuse, she can just sit down now and start having the videos of running through her mind of the trauma that she's been exposed to. And you can see them that some even have nightmares. There are women today that cannot sleep throughout the night because of traumatic experiences. They have nightmares of things that have happened to them, negative things that have happened to them. And, these things can be very, 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 very terrible for people that have this kind of experiences. Another thing that you will see in such people that have been exposed to traumatic events is they begin to avoid people. They begin to avoid people. They begin to avoid places. They begin to avoid conversations, activities that remind them of that event. So, for example, you see, this woman, all of a sudden, she's not coming out for gatherings anymore. She's not mixing with people. And you know that this person used to be a very lively person, used to be a very outgoing person. All of a sudden, they begin to avoid people and you are getting upset. But you don't know that they're actually dealing with trauma. And those are the ways they are exhibiting it. They begin to avoid things that remind them of that traumatic experience. That's why you see some children, they suddenly just cut off from their parents. Why? Maybe growing up, they were exposed to childhood trauma. And their own way of dealing with that situation is they begin to avoid their parents because every time they see that parent, it reminds them of what they've experienced. You see, some even avoid talking about it. Because sometimes you see someone who has experienced trauma and you're trying to help and you are wondering why the person is not, opening up to speak with you about that event. It is because their own defense mechanism is to avoid that situation. They block their mind away from it. They don't want to talk about it. They don't want to remember it because in their own way, if I don't remember it, if I don't talk about it, then I've dealt with it. So you see them, they avoid things. Another thing or symptoms that you will see in people with post-traumatic stress disorder is negative changes in their thoughts, in their behaviors, in their mood. What do I mean by that? They begin to have persistent negative beliefs about themselves, about the world. I've seen people that tell you, oh, I'm not good enough. No matter what you tell them, I'm not good enough. Why? Because they've been exposed to trauma. So everything about them is negative. And with time, you see them, they lose themselves. They lose their confidence. They lose their self-esteem. They see the world as a wicked place. I've seen people that tell you, you know what, I just want to die. This world is evil. This world is bad. Why? Because of the negative, traumatic experiences they've had. Some have persistent feelings of guilt and shame, anger, hopelessness. Do you know that some even begin to blame themselves and say, oh, it's my fault. It's my fault that my partner is being abusive to me. It's my fault that I was exposed, I was raped. Or maybe if I didn't dress well, or maybe because I didn't do this, that's why and it's not their fault. But that is what trauma does. Trauma breaks people. And then you see that they begin to have these feelings of guilt, feeling of shame. And because of even that feeling of shame, some of them cannot talk about these experiences because they are ashamed of these experiences. Then some of them are angry. There are people that you meet and you're just wondering, why is this person always angry? You know, somebody said something. He said, hurting people hurt others. Hurting people hurt others. There are people that are persistently angry because of the experiences they've had in life, the traumatic experiences, and their own way of dealing with it is they just begin to, show anger towards people, towards situation. They are always angry. Any little thing triggers them. And people that may not understand this begin to, label them and say, oh, that person is always angry. It's just because that person has not dealt with themselves. Some, their own way of dealing with it is they feel numb. There are people that they don't know how to respond emotionally to people or situations. Maybe for people that have been abused verbally, emotionally, physically. Now, the symptoms they'll be, experiencing is detachment. They are detached from people, emotionally numb. They cannot show love. They cannot even receive love. So even when you are trying to show them love, they are suspicious. Are you coming again? Oh, you're coming again so that you can come and take advantage of me. And you see, they become very defensive. They block themselves from people. They block themselves from people. And then another thing is increased arousal or reactivity. They're on the edge always. They're always on alert because they are suspicious of people and everything. They are suspicious of everybody. They are paranoid. You wonder why some people are very paranoid. They always believe that people are out to get them. They always believe that people want to take advantage of them. It's because of the kind of experiences they've had in the past. And some other, features that some women, especially particular to women, like I said, is self-blaming, shame, especially for cases like, sexual abuse and all those things. Maybe a woman that was abused in a marriage and then left the marriage. And we know the society, when you see a woman that is divorced, oh, you believe, oh, it's the woman's fault. Maybe she didn't. And you see these things, they begin to blame themselves. Then some signs that you also see in some women is low self-esteem. Like I said, they have been repeated trauma, and then they begin to accept this negativity into themselves, and so they begin to see themselves less of people, less. They lose their esteem. When you tell them to talk, oh, they're always running out, they're always running from people. And then some can have symptoms in their bodies like general body pain, headaches, tiredness and all that. Sometimes when people come with all these symptoms to the hospital, you are looking for things, and at the end of the day, you do all the investigations, nothing. You now ask them, what exactly is going on? That is when you now see that most of them, it's actually mental issues. And then you're able to address it. Some, do you know that the traumatic experiences even affect their sexual drive, that they lose interest in sex? You have women that are married, but they don't even have sexual drive to even stay with their husbands. Why? Because maybe in the past they were traumatized sexually. And so it just kills their libido, kills their interest in any sexual activity. And so you are wondering, why is she like this? Why is she like that? It's because of the experiences that they've had. Now, we've talked about what PTSD is. We've talked about, signs and symptoms that, one that is having post-traumatic stress disorder can exhibit. How do we then deal with them? Recovery strategies. You can seek professional help. When I say seek professional help, you go to the hospital, go to the hospital. You can also therapy. There are different forms of therapies that one can engage, group therapy, one-to-one therapy that one can engage. And then when you seek professional help, sometimes if the doctor, for example, feel that you benefit, they can give you medications to actually deal with this. You know, I've seen people in my clinic that come with symptoms of PTSD, and with medication, they were able to recover well and live their life to the fullest. So there's the use of medication, there's the use of therapy, but you have to seek professional help to be able to assess these services. But as a person, what would you do to help yourself recover from this? First of all, one thing I will always say is own your story. Own it. Don't be ashamed. Yes, you were traumatized. Yes, you went through abuse. Yes, you had this experience. Don't be ashamed. Don't be ashamed about it. You've gone through it. That is, they say go through it. You went through it. Be bold to speak about your story. Because the society has so, when people come out to say their story, society begin to label you and say, oh, begin to blame you. And so then it makes people hide. And when you hide, it is not the right way of dealing with that situation. It is just like you are putting the dirt under the carpet. The room may appear clean, but it's not actually clean, because all you succeeded in doing is hiding the dirt under the carpet. For the day that the carpet is removed, the dirt is going to come out. So when you are hiding these situations, you are hiding. When they say come and talk about it or come and share your experience, oh no, I'm all right, I'm okay, but are you really okay? So own your story. Own your story. Yes, it's not palatable. It's not it is not something that anybody wishes for themselves, but it has happened. It has happened. That's life. That's life. It has happened. Own your story and then tell yourself, I have faced this situation. What next am I going to do to help myself heal from this situation? Another thing you should do is forgive. Forgive yourself. Forgive the person. Forgive the person. Because a lot of people continue to experience these symptoms because they are holding on to that, thing, and the anger is there, the frustration is there. I know, yes, people have been exposed to terrible things. Like when you hear the stories of people, you are like, what? People actually have these experiences? You see fathers molesting their daughters. You see bosses molesting their female staff. You see men, husbands abusing their wives. Yes, it happened. But forgive. Just forgive the person, not for the person, but for your own self. For your own self, for your peace, for your recovery. So forgive yourself, forgive the person. And then what do you then do? Start building a support network of trusted individuals. Because one thing that people do when they're exposed to traumatic situation is that they begin to isolate themselves, and that is not the way out. Look for trusted people that you can talk to, people that can support you, people that can encourage you. Don't isolate yourself, because the more you isolate yourself, the more you begin to, you begin to, because when you're isolated, what do? You are just alone. You begin to reflect on the negativity, and it keeps drowning you and drowning you. Don't isolate yourself. But have strong network of friends that will cheer you up, that will support you, that will encourage you. And then establish safe environment for yourself. Stay away from anything that will bring negativity. There are some friends you may need to cut away, because those friends don't help you. They just keep bringing negativity to you, because you need to feel safe in yourself and in your environment. You need to feel safe. So create a safe environment for yourself. And then what do? Develop Other things, develop healthy skills for managing distress or managing, the triggers, because there will be triggers. I've met people that said, oh, the smell of this particular perfume triggers me. So when the triggers come, what do? Engage in positive activities. Live life. Enjoy your life. Don't sit down and keep sulking and keep, oh, this has happened, that has happened. No. Go and look for things, the things that you love to do. If you love music, play music. You can be in your room, just play music and enjoy yourself. Exercise, do things to make yourself happy. Look for healthy things, healthy coping skills, because sometimes some people, when they're exposed to traumatic situations, they start engaging on a healthy coping strategy. That's why you see some people going into drugs, because they're actually trying to cope with the trauma, the pain they're dealing with. Those are unhealthy things, because at the end of the day, you just cause more trouble for yourself. So look for things that you love to do and do them. And then practice self-care. Be intentional about self-care. Be intentional about it. Sleep well, eat well, exercise well, dress well. Don't dress like your problem. Don't dress like your problem. Dress well. Be very intentional about self-care, because a lot of people that have been exposed to traumatic situations, they leave themselves. You see some women just forget themselves. They start eating anyhow, adding weight because, and then the person that traumatized you is living life somewhere, enjoying himself or herself. Meanwhile, you are here and just living a sad life. It shouldn't be. Take care of yourself and be very intentional about it. Develop yourself. Develop yourself. Learn skills. If you're not educated, go to school or learn skills. Don't let life just stop, because that's what some people do. They just give up on life. No, there's something new you can learn. There's something new you can add to yourself. Look for those things, add it to yourself. You've gone through that situation, yes, but what is the way forward? Don't stay in that program. And then there are a lot of barriers to recovery. I'll just go briefly. Stigma and shame. Like I said, people hide their trauma because they're afraid of what people will say. And by hiding it, they are not able to access the right help and support that they need. And so they keep going on with this trauma. They keep going on with this trauma. But don't allow what people will say or what people will say stop you from, getting the help that you need. Because people will always talk. Whether you do anything or not, people will always talk. So don't allow that be a barrier to you seeking help. Another thing is, cultural taboos. Like I said, for example, the lady I saw that brought her child to me in the clinic, because she said, if I come out now and people will say this, it's a taboo for the father to sleep with the child. But you are looking at taboo, but are you looking at the impact it's going to have on that child when that child grows up? And so because of that, she's not accessing the help that the child actually needs. Another thing is mistrust of people or the systems or financial limitations. We agree, we talked about, therapy and medication and all that. Yeah, somebody is saying, talk about men too. Yes, men too are traumatized. That's the truth. Men too are traumatized. They experience abuse themselves, physical abuse, verbal abuse, emotional abuse. That is very correct. And like I said, own your story and seek the help that you need. Don't be ashamed and say, oh, I'm a man. How will I come out and say I've been abused by my wife? No. Come out, seek the help. If you have been abused as a man, seek the help that you need. If you've been abused as a woman, seek the help that you need. Like I said, be intentional. Be intentional about recovery. Be intentional about recovery, because until you do something about it, you will just continue, living life as a broken person. And a broken person cannot live a fulfilled life. A broken person cannot live a happy life. You will just be frustrated and you keep frustrating those around you. So that's why we have to seek help. And, I want to emphasize that the impact of trauma on men, on women, cannot be overemphasized. Somebody gave an example and said, when you squeeze a paper, when you squash paper, what happens? When you open it, first of all, you know that there's a lot of lines on that paper. And then you see that the paper is not as firm as it was before you squash it, because you have squashed it. And if you don't handle it with care, you see that the paper will easily tear. That's what trauma does. There are a lot of people that are walking about today with a lot of scars in their hearts, a lot of scars. And if they don't seek the help that they need, they will break down. That's why you see somebody, you see, this person committed suicide. Oh, but I saw him yesterday. We had a chat. He was smiling. He didn't, the person is actually broken, but he didn't seek, or she didn't seek the help. And that at a point got broken completely. And then, you know what? They just say, let me end it. So trauma actually makes people fragile, makes people more vulnerable. And that's why they need to be handled with care and they need support. That's why if one has been traumatized, go and seek the support that you need. And it's also important to know that recovery is not a destination. It's just, okay, I've recovered. No, it's a journey. It's a journey. It's a journey. Recovery, it's a journey. And everybody has different pace, because you might have gone through a very traumatic experience and you quickly recovered. And then you see another person that has gone through that experience and has not recovered as fast, and you are upset. After I went through it now. What's your own self? Why? People heal at different pace. Allow people go through their own journey. Allow them go through their own journey. It's a journey. Some people, it may take them weeks to recover. Some people, it may take them months to recover. Some people, it may take them years to recover. Let them go through that journey. Let them go through their journey. And I tell you, please seek help. If you've been exposed to any form of trauma, seek the help that you need so that you can live a very, very happy and a fulfilling life. Thank you.
Oh my
I hope I didn't slip into my time.
no, I'm putting down questions here. I'm telling
Okay.
you, I'm just I'm just that questions, because this topic is a very wide and broad one. But I want to really say that you did justice to it. I never knew that there is a complex PSD.
Yeah,
I thought
yeah.
I thought maybe it's just PSD is PSD. I didn't know that it has is in.
Yeah. Because there are a lot of people that have been, for example, people may just have one event in their life that was very traumatic and that was it. And yes, they might have experienced some of these symptoms, but they recovered. But there are some people, just imagine a lady or a man that is in an abusive marriage. Every day they're exposed to verbal abuse, they're exposed to emotional abuse, they're exposed to physical abuse over a long period of time. In such case, you say that person is experiencing, complex post-traumatic stress disorder, because it's multiple trauma and it's over a long, period of time.
So thank you so much, Dr. Taiye. I must say that you did justice to this topic in the short time that you have. I am really grateful. Please, our dear audience, kindly drop your questions so that I don't become selfish and exhaust my question. I can always ask some of my questions later. Please kindly drop your questions. Okay, so when you were talking, you mentioned forgiveness. You mentioned forgiveness in that one should forgive and all that. So I want to ask, how easy is it for someone who has gone through, traumatic experience or experiences, to be in the mindset to even know, maximize these healing strategies? Will someone be thinking about that? I feel that you what you'll be thinking about is, one, either how the person who traumatized you will suffer, so that you can have closure, that closure of, oh, the person got what they, for example, the case of, a father sleeping with a child. God forbid, I don't think I'll be able to go to, to heal from such situation. Someone was telling me today and saying that in her place of work, she works with vulnerable people, and she was like, she said that a guy came and the guy was saying, just, saying that he just woke up angry today. An elder, a matured man, probably someone in his 50s or 60s, and said he just woke up angry today. And what was the cause of the anger? That he just remembered his father, raping his 12-year-old sister when the sister was 12 years. Now, the scenario is that the sister is almost like his age, close to his age. So you can imagine a sister who is now in her 50s or 60s, and the father is dead. The father is dead, the mother is dead. But the guy, you know, has not, can still not take that thing up. So the thing kind of has lived with him all these years. So I feel that that is this thing, this spot where this trauma take one to. So my question is, how is one able to, come to healing, to this point of healing, forgiveness and all that? How easy is it? How easy is it?
Well, it's not a very easy thing. It's not an easy journey, because like I said, people have been exposed to really, really difficult situation. But the truth is that if you don't heal, you just, it will just be like you keep yourself in a cage. You can't live a happy life. You can't live a fulfilled life. Imagine just the example you cited of the guy that is still waking up with so much anger. So if you don't heal, you keep yourself in that cage of bitterness, in that cage of anger, and it's going to make you not live a happy life. So, yes, it's a difficult situation, it's terrible, but you have to come to that point where you say, enough is enough. I am not going to let this thing limit me. I am not going to let this situation define who I am, and then seek help. I've actually met people that have said, you know what, doctor, I've been through the situation, yes, but I want to live a fulfilled life. What are the help that I can seek? And we're able to refer them to different services to get the support that they need. Because they came to that realization that if I don't deal with the situation, this situation will keep dealing with me, will keep limiting me, limiting, my full potentials. So if you don't come to that realization and say, yes, own your story. It's painful, yes, own it. I've gone through it, but I need to heal. I need to recover, and then seek the help. There are actually people that have come to that point. It's not easy. It's not easy, but you can do it if you are intentional about recovery.
Thank you. Thank you so
Yeah.
much. This topic is very, it's very sensitive. So
Yeah.
now there's a story of true life story. I remember the marriage is no longer in existence anyway. The marriage packed up, of a lady who, you know, carried. I'm talking about transferred trauma now. You know,
Mm.
Saw the way her mother was dealt with in her mother's marriage,
Mm.
and eventually got married, and they had this thing that no man can give me nonsense,
Mm-hmm.
no man can give me rubbish. So, and she became, became defensive, and so even when So somewhere along the line, traces of her father's behavior shows up in her husband. She become angry and quickly want to kill the fire before it becomes a virus. But this even though she tried to behave and everything, but at the end of the marriage as we speak today has ended, no longer anything. So I'm talking about transferred trauma or inherited trauma. Let me just put it that way. Inherited trauma. So she inherited her mother's trauma. So my question now is this: how do we differentiate what what caused trauma in marriage from a couple trying to go through different phases of life in marriage? What do I mean? For example, now, you as a man, you are not probably, your wife is trying to like push you, make you want to do things that you're, doing, see that you are slacking and all that, and your wife is trying to push you and everything, encourage you, use everything possible, and you are now seeing it as abuse. So how do we differentiate between abuse that leads to trauma in marriage and push and drive that leads to growth?
Okay. All right. So, first of all, for that lady, you may call it inherited trauma, but I would say the lady herself was traumatized because having to witness her parents fight, go through, conflict and all that is also traumatizing for the children. For example, we have, situations in England here with people coming down with personality disorders. Why? Because they saw their parents fight. And then they just the impact of those visions and pictures in their head messed them up. And today they are dealing with personality disorders. So that one is a trauma on its own. Then for the question that you said, how do we differentiate push and then trauma or abuse? What is your motivating factor? Is it from a place of love or from a place of, because if you are saying you are pushing a person to be a better person and you are doing it from a place of love, then you would know when you need to stop. You would know when, oh, I've said these words and maybe this person didn't take it well or is not understanding my intention. And then you calm down and say, you know what, I'm just saying this because I want you to be better. But if you are saying it from a selfish interest because you feel that, you are not meeting up to life. My friends are this, my friend's husband is this, or my friend's wife is this, and you are not meeting up, and you are doing that. That is not love. That is selfishness, and that is abuse. Because you see a man now that is verbally abusing his wife, for example, oh, you are too fat, you are ugly, you are this. That's not love. That you are not pushing her to be a better person. Because if you are pushing a person to be better, you will do it from a place of love. And if there's love, there will be emotional intelligence enough to know the impact of what you are doing on that person, and you will do it in a way that the person will not feel judged or condemned. So if you are doing it from a selfish point, that is abuse. That is not pushing. So if you want your partner to be better, you can call the person down. Call the person and say, okay, babe, maybe is it good you learn this skill, or let's do this, let's do that. Then the person will be, except the person is just a stubborn person. If you give a person advice in such manner, I'm sure they will be happy to take the advice. But some of us, what we call push is actually abuse, because my mate is this, your mate is that, you are this, you are that. That's not push, that's abuse. So the way to differentiate it is, what is your driving what's your motivating factor? Am I doing it from a place of love, or I'm doing it out of my own selfish interest? Yeah.
Thank you so much. But I want to add that sometimes in marriage, you can, there was something that was shared by a known personality of, she shared it on her Facebook. That's Mrs. Chioma Ifanieze. And she mentioned how someone reached out, a woman reached out to her, and the woman said that her marriage will be 10 years this year, and that in that 10 years, her husband has refused to grow. She has done everything. He refused to train, refused to do anything, and she has done everything she could, and the man has refused to go. And then what she had that decided to do was to withdraw and start growing on her own. You know, and start with and I said that can be very dicey, because to what extent can you withdraw to start growing on your own? Because once you withdraw and start growing on your own, you are gradually, that's some of the advice that people give. You have left that marriage. You have left that marriage. You are no longer, because that means you are on your own. You are already, and then when it gets to an extent where you just, for the sake of your own peace and sanity, you want to do your own thing and leave the person. You are no longer pushing. There are some people that if you I'm speaking Yoruba, that you say, oh, please, you need to do this, you need to do this. Some people don't need that. They need you to give them, to be firm and firm and say, see, this is what the outcome will be if you don't do this. This is what I think you need to, some people really need that. And yeah, like you said, I agree with you in the place of love. But love, there's tough love also. Because when you try to make the person see where the part they fail to play will affect you, because you share that, but that's a institution called marriage together. I think. Thank you so much, Doctor. I don't know. I'm not seeing question. What is happening, people? Okay, then don't you think that the the most safe thing? No, I think you mentioned it, but the most safe thing to help one heal is to separate from the environment and the person where the abuse, emanates from.
Yeah, so it depends on the situation. There are some situations you actually have to take yourself, out of that, situation. So if, for example, you are in a marriage that your partner is physically abusive, I wouldn't say stay there. You have to take yourself out until the person seeks the help that they need. But for example, if you are the type that people bully you, maybe for example, you are fat, and then people are talking about you, body shaming you, would you say you take yourself out of the world? So in that situation, what will you do is for you to love yourself, appreciate yourself, and not mind whatever anybody is saying and all that. So it all depends on the situation. And then if there are situations that, yes, you really need to take yourself out so that you don't get hurt in the process.
Okay, ma'am. Thank you so much. Then, in Africa, most people are not diagnosed. We're talking about women now. Most people are not actually diagnosed. So we have a lot of, we have this conclusion where they say, don't work with a female boss. So they are always angry, and they are this and this. I think probably it's because women are generally emotional.
Yeah, that's true.
So should we conclude that most women have that traumatic experience and all that, and so this reflects in even their leadership position? So from what you have taught this night, I want to say that probably if further investigation is taken, we'll find out that most of these women who are leaders and bosses are actually battling some trauma from when they were children.
Yeah, that's true. That's very correct. Very
So,
correct. Because, yeah, okay, yeah, I'm listening.
thank you. No, I'm listening.
Okay, yeah. So that's very correct because when we talk about trauma, people just think it's just physical trauma or blowing and kicking. No, people have been exposed to verbal abuse. People have been exposed to emotional abuse. And so then when, like I said, they become all defensive, they become alert because they believe that people are out to get them. And so when they are in a place of power, if they sense any form that anyone is trying to take advantage of them, they're already ready to attack, and then you are wondering, why is this person aggressive? It's not as serious as it is. It's because of their, previous experiences. A lot of people are traumatized. They have scars that have not been adequately dealt with. And so they manifest these things in behaviors. They are angry. They don't trust people. They are very paranoid. They are very, impatient, or it can actually go on two extremes. Either they become very aggressive or they become very timid. They lose their self-confidence, they lose their self-esteem and all that. So people actually, but if they're able to deal with it and recover, then they're able to, come out of this and be the people that they should be.
Okay, thank you so much. Another question I want to ask is, please though, my people, what's happening? I'm not seeing questions. Another question I want to ask is, is there any difference between signs and symptoms of PTSD in young girls and adult female?
Yeah. So it may be the same, it may be different. All right. So, but usually in young girls, some of them don't talk about it. What you will see is that they begin to become very quiet. They begin to isolate themselves from people. So those are the signs they may, because, considering their age, considering they are afraid of the reaction they may get from adults, they may begin to isolate themselves. Another signs you may see in children, young girls that have been exposed to traumatic events or have been abused is that they begin to become rebellious. So you see a very calm, gentle girl all of a sudden is becoming rebellious, is now going into drugs, is now dressing, anyhow, is now becoming unruly, becoming rude to people and all that. And sometimes, some parents are not patient enough to actually sit these children down and say, what is happening, and get to the root. Just, this child is getting this, is getting that. But that is their own way of expressing the pain and the hurt that they are experiencing. And then for young children, or even it even happens in adult, because I've seen this in adult, you see some start self-harming. What do I mean? You see some start cutting themselves. I've seen young ladies, I've seen older ladies, they take razor blade, they are cutting their hands, some are pulling their hair, some are putting their hands or leg in fire, burning fire to burn themselves. And when you ask them, they tell you, oh, that is the way I'm dealing with the pain that, is I feel inside. So you will see that in younger children or in adults. Then for women, like I said, they may be very angry. For the married ones, they may not be interested in sex because they've been traumatized, and so they are not just interested. Some may not even want to get married. That's the truth. Some may not want to get married because of their previous experience, and then some struggle with relationships. So that would be another topic on its own, the impact of trauma on personality. You see people exhibiting some personality disorders because of trauma. So, for example, one of the common personality disorders that we tend to deal with here is the personality disorder called borderline personality disorder, or it's also called emotionally unstable personality disorder. And behaviors that you see in these people is that their mood fluctuates. So some people that you say, oh, this person has mood swing, is actually because of abuse they've faced. So in the morning they are happy, in the evening they are very angry, moody, and you're like, what happened? I didn't say anything. They have difficulty with regulating their emotions. You see that. Then some are very angry. Any little thing triggers them. They are very angry. And then some, they lose their esteem. They have low self-esteem. They lose their esteem. And then that's why you're wondering why you see some people that have been abused, they actually like staying in abusive relationships. because they have started identifying with the abuser. They're okay. That's why you see some girls who say, this guy is too quiet. I like a man that will beat me and tell me, sit down there. So if you check, most of the time they've been abused before. And so their own way of dealing with that abuse is actually to start living, with the abuser. They are watching, that's their own way. They're happy when they see a person treating them with love. And then some self-harm and all that. So there are different behaviors that you can see, and it can be seen in both the young and the old.
Thank you so much, Doc. I have another question. Can you help us get a better understanding of the difference between PSD and other mental health conditions?
Which mental health condition? You have many mental health conditions.
Oh, okay. Like, I don't know. Like, I don't know.
Okay, because when you say mental health conditions, there are plenty. You have the post-traumatic stress disorder, it's a mental health condition. You have different type of anxiety disorders, it's a mental health condition. You have personality disorders, like I was saying. Like personality disorders is mainly seen in people that have been exposed to, trauma, childhood trauma, and then it affects their personality because growing up, we need a healthy environment to be able to develop the right personality. But for people that did not get that, ideal environment, it affects the formation of their personalities. And then that's when you see those that, start exhibiting personality disorder. So that's another mental health illness on its own. And some can even have schizophrenia, that's madness, because of traumatic experiences. We've had people that actually became really like mad just because of trauma that they were exposed to. You have that. Then you have some that even go into severe depression. Their mood is low. They don't have any hope for life. All they just want to do is die because of depression. I've seen a lady that just wanted to die. If you had, she always had people around her to hold her because she always wanted to die. And what happened? She was in a very abusive relationship, an abusive marriage, and that messed her up and affected her. So it can exhibit in different mental health illnesses.
Thank you, ma. I have about 3 more questions. I'm very brief. There's this general upbringing that we have in Africa. Let me just say, that, at least in Nigeria that I grew up with, that keep your thing to yourself. Don't overshare. Don't share. Don't talk. You understand? Everybody have the problem they are going through. It's not only you that have problem. I've had someone tell me that I kind of like I was really in a particular state of pain, and I just thought to share because I saw her, and then she responded and told me, well, everybody have what they are going through, Jerry, my sister. Your own is not, you are not the only one going through this problem. So because when you were when you were teaching, you mentioned getting you're like a community of like minds, and other people who you could actually share with and all that, and they could help you during therapy. So now, how do one come out? And you also spoke about sharing your story. I remember when I was when I shared the story of my life and how I, family and all that, went through my years from when I was young to even up to adulthood, my early adulthood. I had people come to me and say, you are sharing too much now. Why are you sharing your family life on social media? And I said to the person, that I just know that there's someone out there who might be going through something like that, just to encourage the person. That is and someone even told me today that all I just all I need she said, I know what is going. I think I don't know what is going on in your life. I know what's going on in your life. All I just need to do is go to Facebook and I will know what is going on. And I laugh and I told her that you don't know what is going on in my life. You don't know what's going on in my life as you speak. You might think you can deduce from my write up on Facebook, but you don't know what is going on in my life. Like, so how can one develop, go beyond that, mindset we're given to actually build a community that will help the person overcome PTSD.
All right. So, like what we're doing now is creating awareness for people to know that, talking about this thing is not a crime. You shouldn't be ashamed of your story, because there's also healing in being able to talk about these things. Like when have you noticed that, for example, you are stressed about a particular thing or you're upset about a particular thing, and then you talk to somebody about it? What happens? There's this kind of relief that you feel. And that is how it is too with, traumatic experiences. If you've had a very traumatic experience, or you're being abused, don't just die in silence. Don't die in silence. If I wouldn't say it's anybody that you see, that there are people that that these people are trusted. I can open up to this person and this person will not judge me. This person will be able to give me advice. Talk to such people. If you don't have such people, then you can actually seek professional help. You have therapists that you can talk to, and they'll be able to give you advice. Let's not, and then when people also come to share with you their experience, don't judge them, and don't invalidate them, because that's what a lot of people do. When people come to share with you their experience, you say, we too, we are going through. You are invalidating that person's feelings. They have gone through that experience. They have the right to feel the way that they feel. Don't tell them how to feel. So if anybody comes to tell you, okay, now you feel this way, what can we do to help you? What can we do to support you? So, and that's, and don't talk, it's affecting a lot of people. That's why you see you have a lot of broken people, sad and frustrated people out there today that are harming people, because the environment, the society is not allowing them share their experience, because they are going to shame them. And so they are going about destroying people's lives, hurting other people. So when it felt for us, it is creating this awareness, and by so doing, we are creating an environment where people can actually share their experiences without feeling judged or without feeling, condemned. And then also for us, look for trusted people, look for friends or family or members or professionals that you can actually talk to. Don't keep it, because one thing, the illustrations I always give my patients in the clinic is that like the balloon. If you keep pumping the balloon, and it gets to the limit, what's going to happen is going to burst. It's going to explode. And that's how it is. When you're dealing with a lot of stressful or difficult or traumatic experience, you are not sharing because you are saying, oh, don't talk, don't talk. At a point, it's going to explode. And when it explodes, that's when you see people doing things that ordinarily they would have not done, because they did not share, they didn't talk about it. So I think that's it.
Okay, a final question is, we want to know if we want to access medical help, which medical professional do one go to,
Okay.
for therapy when it has to do with PTSD? That's number one. And how affordable is it? That's one. Then one. So the first one, which medical practitioner do we go to? One. Then 1B, how affordable is it? And then another 1C, how can one help as an initiative? How can we help? How can we help? So that we don't fall into legal. How can we help? Women who are
Okay.
going through some. Thank you.
All right. So for the professionals, because I am in England, if I see a patient, first of all, usually you go through your GP, and then the GP can manage it. If not, they will refer you to the psychiatrist or psychologist. But back home in Nigeria, I think you can go to the psychiatrist. I know back home in Africa, when you hear psychiatrist, hey, I'm not mad. I don't need to see a psychiatrist because everybody believes that it's only mad people that see the psychiatrist. No, if you are dealing with it, go and see a psychiatrist, and they can either, assess you. If they think you need medications, they can offer you the medications that you need, or if they think that you need therapy, they can actually refer you, to see a therapist or a psychologist, and you get the therapy that you need. So usually the people involved is the psychiatrist or the psychologist. They can help you. You have, in Africa, you have private therapists for those that can afford it. Then, in terms of affordability, I can't really comment on that because I think where I am, the system is run differently back home. I know in Nigeria you have to pay for your services, for the services. So if you're assessing a psychiatrist, you have to pay. If you're assessing a psychologist, you have to pay. I'm not really sure about the prices, but yeah, there are actually therapies that the government can offer, and you can access it free. It's just that the waiting time may be long. But if you don't want that, you also have private therapies that one can access. Yeah, that's in terms of affordability. I'm not really able to comment on that. I'm not sure of the prices. And then what we can do for women is, well, it's one of which is what we are doing today, having programs like this, talking about this, and telling people to be able to, come out and seek the help that they need. Don't be ashamed of your experience because, you've gone through it. That is it. It has happened. What is the way forward? So be intentional about recovery and look for the help that we need. So creating awareness and then creating a safe environment for people. We as women, when we see a fellow woman come to us to share their experience, let's not judge them. Let's not, just invalidate their feelings and say, sis, I beg, I beg, I beg. Me too, I'm going, listen to them. Give them a listening ear, because a lot of people are keeping quiet today because nobody wants to listen. Everybody's busy with their own affairs, which I understand. The world is busy. We all have our personal thing. But when somebody is vulnerable, enough with you and is sharing with you their difficulties, listen to them and help them. If you can, signpost them to where they can seek help and support them. So women supporting women. And then for the men too, because I know we have men, watching this program, seek help too. Seek help too. And don't be ashamed that, I'm an African man. How will I come out and say I'm being abused? Because if you don't deal with that, you would exhibit these signs of this trauma in different ways. You may just be a very angry husband or an angry man, and you are making your loved ones around you, really upset because you've not dealt with it. So as a man, don't go under that canopy that an African man, we deal with things our way. Look at it now. Men are committing suicide more now. Men are falling down, dying of hypertension and heart attack because they are just dealing with a lot of things, dealing with a lot of stress, and they are not seeking help. They are not talking about it. So as a man too, seek the help that you need so that it can help you recover and you can live a very happy and fulfilled life.
Oh my goodness. What an educated therapeutic us. We can go on and on and on about questions, but I happen to be the only one asking questions this
Yeah.
night. Well, I actually understand is that most times questions that like on topics like this, people just like to sometimes people like to listen and knowledge than ask questions. Thank you so much, Dr. Taiye. Thank you for honoring us with your presence. Thank you for honoring us with your expertise. One thing that I'm so blessed on this initiative is that, and that gives me the 100% conviction that God is in the story, is the favor that the initiative has received thus far, especially when it concerns a discussion platform. Thank you so much. And busy person, but I know that we are still coming back. So let me say we will still come back. Please put us schedule. Thank you so much, ma. And I
And
want
thank you too for the opportunity, being on this platform, to be able to share. And I just want to acknowledge my mom. My mom is listening.
mom.
Thank you, mommy.
When I said, I'm like, okay, that's okay. Maybe it's like you are using mommy's name as your
No,
name on
no, yeah,
Facebook.
so I'm also a Lavisi, yeah.
Okay, oh, wow, powerful. So much. I want to appreciate everyone that stayed on this, discussion platform. This discussion platform is very unique and different. That's why we are very much at home in when we come on this platform, in the sense that we want to discuss, we want to make it as like we're at home talking and gaining help. I was telling someone today, I said, even though I coordinate affairs of the initiative and I'm the founder of the initiative, I have the healing that I have received on this platform, with topics being treated and everything, has been, see, I have become a calmer person, a much more calm person, not in terms of my boisterous self, but in terms of the way I react to things and so many things. And it's all began on this platform, you know. I want to say a big thank you to you, Dr. Taiye. Thank you so much. And to everyone, will come your way next week Saturday. But then before we come, join us next week Saturday. Next week Saturday, we're talking about depression in women, a ravaging menace. So this April, we are just talking about women and mental health and everything, because next week, 22nd, we're going to talking about burnout in women, how to manage burnout in women. April is loaded. We can't go to April on this discussion platform and not receive your wholeness. Until I come your way next week, I want to see you, stay blessed, and say beautiful. Thank you. Bye.
Bye.